So studying community safety to me means looking at where communities have what they need in order to stay safe. The research is really, really clear that there are situations and contexts that risk violence and unsafety, and situations and contexts that protect against those things. So employment and youth connectedness and educational outcomes and wealth equality, not disparities, are all things that predict that communities are going to be safe places.
A lot of my work is qualitative, is talking to people and making our research come alive with their stories.
Minnesota Compass is a social indicators project. And what we do is we measure Minnesotans' quality of life by tracking trends related to health, education, our workforce, and our economy. We compile those trends, and then we make that data available to community leaders and policymakers and Minnesota residents to support data-informed decision-making.
One of my projects is with a grassroots community-based organization in North Minneapolis that serves systems-involved youth. The goal of our project with this organization is to first develop a theory of change and logic model to describe the context of their work, their approach, and their expected impact.
One of our clients is a school district that's kind of in Minneapolis and a couple of surrounding suburbs that is primarily for at-risk youth and like high-needs youth. They go from kind of traditional public schools into the school district. And one of our projects was to evaluate a program that they have for school-based workers to respond to any sort of like incidents in the schools. They actually got rid of school resource officers or police officers in schools and backfilled those positions with school-based, what they're calling student safety coaches.
The Minnesota Compass team developed a data section specific to the COVID-19 pandemic. And we provided analyses, not just on data in terms of health, such as COVID-19 cases and hospitalizations and fatalities, but we took a look at how communities have been impacted by COVID-19, both economically and in terms of our workforce, and identifying where people with underlying health conditions and other key social determinants of health live, such as those living in poverty or those who are unemployed without health insurance.
A crisis is like an opportunity for change, and the recent racial justice uprisings has shed light and moved the issues of the criminal justice system to the forefront of all our hearts and minds.
I think we need research more than ever to understand how our communities have been impacted by COVID-19. And really the work is just beginning as more data will be made available to all of us about the long-term effects on our older adults, communities of color, children and families, not just in terms of health, but in terms of the economic impacts, the workforce impacts, the impacts on education. So we're really just getting started.